the rapidly accelerating world of artificial intelligence, few questions spark as much curiosity and anxiety as whether AI could replace doctors by 2030. And in conversations led by Marc Andreessen and Ben Horowitz, this topic takes on an especially bold and transformative tone. They argue that AI's evolution isn't merely a technological upgrade but a fundamental rewiring of how society approaches diagnosis, treatment, and long-term health management. Imagine a world where advanced models can instantly analyze a patient's entire medical history, genetic profile, lifestyle, and environmental factors within seconds, something even the most skilled human doctors cannot do consistently. They describe how AI systems are already outperforming humans in pattern recognition tasks such as reading X-rays, MRIs, and CT scans with extraordinary precision. As these systems improve, the margin of error narrows, the speed increases, and the cost drops dramatically, making high-quality care more accessible across the globe. But Mark emphasizes that the rise of AI in medicine is not about technological supremacy. It's about reducing human suffering by shrinking diagnosis time from days to minutes, and treatment planning from guesswork to precision-based personalization. Yet the fear persists. If machines can do so much, will human doctors still have a place? According to both Mark and Ben, the answer is complex, because human empathy, reassurance, moral judgment, and deep contextual understanding offer irreplaceable value, but only if doctors choose to integrate AI as a partner rather than resist it as a threat. The conversation deepens as they examine current examples of AI-driven breakthroughs that hint at what 2030 might look like. In some hospitals, AI tools already monitor patients in real time, predicting heart attacks hours before they occur. Algorithms detect diabetic retinopathy earlier than traditional screenings. AI chatbots perform mental health triage faster and sometimes more accurately than human counselors. These aren't futuristic prototypes. They're functioning systems quietly embedded in health infrastructures today. Marc Andreessen notes that the real limitation isn't capability but deployment, bureaucracy, regulation, slow adoption by institutions, and resistance from industries that fear disruption. He paints a picture of 2030 where decentralized AI medical assistants could live on every smartphone, able to interpret symptoms, read uploads of medical reports, predict risks, and guide users toward effective treatment options, often before disease becomes serious. Ben Horowitz adds that such systems won't replace doctors, but will shift their focus from basic diagnostics to complex decision-making, surgeries, human communication, and nuanced cases requiring emotional intelligence. In their view, AI becomes the first line of healthcare, while doctors become strategic specialists who intervene when complexity demands it. This hybrid system, they argue, could dramatically reduce healthcare costs, especially in underserved regions where doctor shortages are critical. In exploring the challenges ahead, the discussion moves toward the ethical dilemmas surrounding AI's integration into medicine. If algorithms outperform doctors, who is responsible when the system fails? Mark explains that accountability frameworks must evolve, perhaps involving shared responsibility models between AI developers, healthcare providers, and regulatory bodies. Data privacy becomes an even bigger concern, as AI requires massive datasets to function effectively. Ben notes that without strong protections, sensitive medical information could be misused, misinterpreted, or exploited by bad actors. Yet he emphasizes that humans are already making dangerous medical errors, millions every year, and AI could reduce those dramatically if implemented ethically. They argue that fear should not prevent progress but guide it. AI should be transparent, explainable, and continuously audited. Importantly, both stress that human oversight must remain central, especially when life-changing decisions are involved. They envision AI as a powerful advisor, a system that presents doctors with probabilities, risk indicators, historical comparisons, and recommended actions while leaving final judgment to humans. But they also warn that ignoring AI advancements could widen global health inequalities, because countries that embrace AI-driven medicine will see exponential improvements in longevity, early disease detection, and personalized care. As the conversation continues, Marc Andreessen introduces the idea that medicine today is more reactive than proactive, and AI could reverse that completely. Instead of waiting for symptoms, AI systems could predict disease years in advance through continuous monitoring of biological signals, sleep patterns, movement, voice tone, facial microexpressions, heart rate variability, and more. These digital biomarkers offer insights far beyond what traditional checkups provide. Imagine a system that alerts you to early signs of depression before you consciously feel the symptoms, or predicts cancer risk long before tumors form. Both Mark and Ben believe this level of predictive healthcare could become standard by 2030. Doctors would no longer spend most of their time diagnosing. Instead, they would help patients interpret AI insights, make lifestyle decisions, choose preventive treatments, and emotionally process the results. This shifts medicine from a crisis response model to a continuous optimization model, where well-being becomes a constant process instead of an emergency protocol. They believe the greatest promise of AI lies not in replacing doctors, but in preventing illnesses that overwhelm healthcare systems today. The discussion then explores real-world barriers preventing this future from arriving sooner. Medical institutions are notoriously slow to adopt new technologies, partly due to regulatory constraints and partly due to risk-averse cultures. Mark suggests that to reach meaningful AI-driven healthcare by 2030, innovators must work closely with policymakers to modernize regulations that were built for an analog era. Ben highlights how insurance systems often discourage innovation by refusing to reimburse advanced digital diagnostic tools. Without economic incentives, hospitals won't adopt new systems, even if they're better. Another major challenge is the trust factor. People may trust doctors because of their human presence, but trusting an algorithm requires transparency. The system's reasoning must be understandable, not a black box. Mark argues that as AI becomes more accurate than human doctors in many domains, patients will gradually shift their trust naturally, but only if the AI consistently demonstrates reliability, empathy through design, and safeguards against misuse. This means AI systems must not only perform well, they must communicate well, offering explanations in plain language that help patients feel informed and empowered. Toward the later part of the conversation, the focus shifts to what doctors themselves think about AI. Many fear job loss, but Mark and Ben argue that a far more likely future is job transformation. They predict that by 2030, doctors who embrace AI will work more efficiently, with less administrative burden, fewer diagnostic uncertainties, and more time for personal connection with patients. AI could automate paperwork, manage records, interpret tests, schedule appointments, and handle data analysis. Instead of spending half the day on clerical tasks, doctors could return to the core mission of healing. Ben notes that historically, every major technological leap initially sparked fear: automation in factories, calculators in mathematics, computers in offices, but ultimately resulted in better productivity and more fulfilling roles. They believe the same will happen in medicine. Doctors won't disappear, they'll evolve. They'll become leaders who oversee AI-driven systems, set ethical standards, and provide the human warmth that no machine can replicate. In their view, the doctors of 2030 will be augmented professionals, not obsolete ones. The conversation then moves into the broader societal implications. If AI democratizes healthcare, millions of people in remote or poor regions could gain access to high-quality medical guidance for the first time. This could reshape global health outcomes dramatically. Imagine a child in a village with no doctor, but with access to an AI system that can diagnose infections, guide treatment, and connect with remote human specialists when needed. Marc argues that such access could add millions of healthy years across the planet. Ben adds that governments and NGOs must play a major role in scaling such systems ethically, ensuring affordability and preventing monopolistic control by private corporations. AI must be treated as a global public good in healthcare, not just a profit engine. They also discuss how medical schools will need to change, training future doctors to work alongside AI, interpret algorithmic outputs, and maintain human-centered care. Education, regulation, economics, and social values will all determine whether the future they describe becomes reality. Finally, they conclude that the question, will AI replace doctors by 2030, is the wrong one. The real question is, will we use AI to make healthcare dramatically better by 2030? Marc and Ben firmly believe the answer is yes, if society embraces the opportunity. AI won't replace doctors, but doctors who use AI will replace doctors who don't. The strongest healthcare systems will be hybrid models where advanced algorithms handle analysis, prediction, and monitoring, while humans provide judgment, empathy, connection, and ethical guidance. They warn that the biggest danger isn't giving AI too much power, it's failing to use AI's potential to reduce suffering. As they see it, the future of medicine is not human versus machine, but human plus machine. And the next 5 years will determine whether we step into that future boldly or cling to outdated systems that limit progress. For them, AI is not a threat to doctors. It is the most powerful tool doctors have ever been offered, and embracing it could lead humanity into a new era of longevity, wellness, and medical precision, unlike anything the world has ever seen.